Okay, so we're going to pick up today at vaccines. It looks like it was coming on. So there's different kinds of vaccines, and you may remember some of this from 109. We have live attenuated vaccines. So this is actually a weakened or a component of a live microbe. It's not the infectious component, but what it does is it causes your body to create an antibody to it. So it creates an immune response. We use this for polio, which currently we don't use the polio vaccine in the U.S. We've pretty much eradicated polio in the U.S., but that's a virus. Measles, mumps, and rubella, which is combined into the MMR. So rubella is German measles. Those are all viruses. And then the intranasal flu, which is why certain populations can't use it, like pregnant women. We have inactivated or killed vaccines. These cannot mutate. It is what it is. Now, with these, you're going to need a booster. It's not going to continuously give you immunity. But we also know that pretty much there's no guarantee with any vaccine that we're going to have lifelong immunity. So back when vaccines first became very prevalent, back in the 50s and the 60s, we thought that we would have lifelong immunity. And we found out in the 1990s that that was not true. Pertussis was the first thing that gave us that kind of, ooh, hey, it wears off as we get older. And we were finding grandparents were contracting pertussis and giving it to babies who could not be immunized yet. So pertussis is whooping cough, and it can actually obstruct the airflow. So it can be very, very serious for babies. So we know that there are certain things. We always knew that we needed certain boosters like polio. When I was a kid, I remember lining up at kindergarten getting my polio booster. It was oral. They didn't give me another shot. Hepatitis A needs a booster. Your flu. Every year we need a new flu. Maybe soon we're going to have a flu vaccine that will be good for years, kind of thing. They're trying to get the component of the flu virus that doesn't change to create that vaccine. There's a toxoid vaccine. So this stimulates the immune response to produce antibodies to toxins that can cause an illness. So certain, especially bacteria. So tetanus is a chemical, it's an endotoxin that's produced by a bacteria that causes that poisoning. And that can cause a problem with the way your calcium works, and it can cause your muscles to freeze up, including the ones in your face, which is why they call it lockjaw. So we take tetanus shots prophylactically, right? And it's usually combined with the diphtheria. And then we have conjugated vaccines. These link antigens or toxoids to a molecule on the bacteria and use it as a disguise. So it allows the immune response to recognize the bacteria. So the Haemophilus B, which can cause meningitis, this is actually a bacterial meningitis, would be a conjugated vaccine. So it's kind of a combination vaccine. Conjugated means to come together or combine. So it's a combination of the way that the vaccine is formulated. Bacterial meningitis is highly contagious. People who live in close contact, we find a lot of times, like college students that live in dorms and things like that are prone to this. Young children are prone to this. It's preventable with this vaccine. And if somebody gets this type of meningitis, it can cause very, very serious, lifelong, even potentially lethal infection. And sometimes patients who do get this, they could be basically a vegetable. It can cause brain damage. It can cause them to lose their eyesight. Meningitis is not something to play with. So because this is preventable, it's highly recommended in the vaccine. Now, part of the thing, and this kind of also crosses over to pharmacy practice, is proper handling of vaccines. Vaccines are bioengineered. They are produced in a lab, but they're from a live resource to begin with, so they have to be kept in cold storage. So we have that cold chain that needs to be maintained. So because it's an immunological, refrigerate between 2 and 8 degrees centigrade or 36 to 46 degrees Fahrenheit. We have to have the safe handling practices. When it's shipped, we want to have that little monitor component that it'll tell us if the temperature gets out of range. And that's from the manufacturer all the way through administration. So this is just a list of the different types of common vaccines that require this cold chain. And why is cold chain important? Well, it helps maintain the shelf life. It helps make sure that it stays active, that it's not inactivated by too high a temperature. Once it's compromised, we can't fix it. It's broken. Patients at risk for suboptimal vaccines. So we don't want to have vaccine failure. We don't want to have reactions at the injection site. Think of it like leaving something out of your refrigerator that gets spoiled and then how you can get sick from it, kind of along the same lines. So we have to maintain our refrigeration units. Generally, you're going to have a separate area, if not a complete refrigerator, but an area in your refrigerator where you have your immunological agents. It has to have good airflow, so you can't just pack it full so that there's no air circulation. You have to have your minimum maximum thermometer. So most of these have electronic gauge thermometers, and they'll have alarms. So if the refrigerator goes out of temperature. So I know my own home refrigerator, if I leave my door open too long, it starts beeping at me. You know, it's like, hey, close the door. So we want to have an alarm in case that refrigerator temperature goes out of whack. Sometimes maybe you blew a fuse, maybe there's a problem with a compressor on the refrigerator. You know, just like the stuff at home, professional refrigerators can fail too. We don't want to put refrigerators anywhere near a heat source because of the compressors already generating enough heat. We don't want it to overwork. It's kind of like, I used to have a convertible. You don't run the air conditioner in the summer with the top down. It will overwork the engine. So you don't want to put your refrigerator near a heat source. It's already trying to cool down, creating its own heat. You don't want to put it next to another heat source where it has to work even harder. So the protocols, I've talked about these before. Just a little review. You know, you want to make sure that everything's taken care of. You're tracking it. You're making sure it's put away right away. You're making sure it stays refrigerated till it's time to administer. Bring it up to at least room temperature, if not body temperature, prior to administration. You want to rotate your stock. Make sure you've got your earliest expiration dates being used first. And leave them in the refrigerator. Don't take them out and move them around for any reason. So when we are transporting, same thing as I've talked about before. Usually comes in a cooler, an insulated container. We have those ice pack protocols. It will say how many you're supposed to have, how big they're supposed to be. They shouldn't come in direct contact. Those temperature monitors that I was talking about. And then warning signs that the cold chain's been broken. So is the freezer pack thawed? Bless you. Is it warm to the touch or, you know, room temperature to the touch? Did it have dry ice in there? Was it supposed to be a frozen vaccine? Has that evaporated? Is there no dry ice left? Can you see? Well, probably not. Visual is very difficult to see that a cold chain's been broken. Could possibly have some clumps or something like that. Now, if the vaccine's been compromised or if it's expired, it has to be disposed of. So immunizations, we use them for what we consider childhood diseases, which kind of gives people a misconception, for lack of a better way of saying it, regarding vaccines, because we think, oh, it's a childhood disease, it's no big deal. babies, children, and adults die from chickenpox. You know, most people, if they have chickenpox or have had chickenpox, don't have a real serious outbreak. You know, it's itchy, it's got those bumps all over, but it lines epithelial cells, which means it can line your organs, it can get in your throat, it can get in your eyes. It's a herpes virus. So it can cause blindness, and in an adult, it's even more serious than it can be sometimes for children to get chickenpox. So it can cause sterility. Well, there's that whole anti-vaxxer thing, which we know it all started with a doctor who's since had his credentials taken away because he lied. He made it up, saying that there was a problem in there. They've proven that none of that stuff is true. Now, there's no guarantee that a person may not have a reaction to a vaccine, just like there's no guarantee that a patient may not have a reaction to any medication that they could try. They could be allergic to something, maybe in that's made. And we hear that on TV commercials when they're talking about vaccines. If you have a sensitivity to eggs, don't use this vaccine, because they grow it in an embryo of a chicken, of an egg. There's going to be that small population that could have a sensitivity or a reaction. But it's not going to cause autism, it's not going to cause seizures, it's not going to cause all these other things that people proclaim is why they don't give it. And in a sense, as a responsible civic member, a member of society, if you're a healthy person and you contract some of these less severe on a healthy person, you'll probably be okay. But there's people who can't be immunized. And if they contract these because you caught it and you gave it to them, they could die. There's an ad out right now that I kind of like. It's like, this is Jim. Jim didn't get the flu vaccine, but Jim got the flu and he's okay. But his grandmother is not. You know, it's like we've got to think about the other people. And then it comes, you get that whole ethical, moral component, you get the anti-vaxxers, and then their children are told they can't come to school. And they're like, well, why can't Johnny go to school? Well, because Jimmy is undergoing, he's got leukemia. He can't take a vaccine. So if you get sick and you give it to him, who has the right to be in the classroom? It's got to be one or the other. So if you make a choice not to do something, then you're the one who's going to get excluded, kind of thing. It's not Jimmy's choice. It's Johnny's parents' choice. So it's a sticky situation for some people, but we'd have a lot more people die today if we didn't have vaccines from like meningitis. So we have bacterial meningitis, the HIV, we've got viral meningitis, we've got vaccines for rabies. That's a toxoid vaccine. Pneumonia, pneumococcal, especially the elderly, people who have respiratory disorders. If they get sick, then they're going to be prone, a cold or bronchitis in someone who doesn't have a breathing disorder, they recover in a relatively short period of time. But if somebody who has asthma or COPD or chronic bronchitis, it could kill them because they can't clear their lungs. Hepatitis, pretty much all strains of hepatitis now have vaccines. And then the influenza. So CDC, the Centers for Disease Control, has recommendations of when is appropriate to get what immunizations, what boosters, all that kind of stuff. So, I'm sorry? Yeah. Especially if you have kids. You've probably seen this. So from birth, they can get the hepatitis B vaccine, but that's the only one. So until they're 2 months to a year old or older, they could be susceptible to certain things because they're too young to be vaccinated for them. So that's where we want to do the protection. Like measles, mumps, rubella. They can't get that till they're a year old. And this takes the kids through, and then we have adults. So as a technician, we are part of the process, especially in a community setting. Most states allow for immunizations without a prescription. So in the state of Louisiana, bless you, anybody, I believe it's 17 or older, following CDC protocols does not need a prescription for vaccines, according to CDC, as long as it's in those parameters. If it's a child, we can still vaccinate them in the pharmacy, but they need a prescription for that. So we do find that some doctors' offices have stopped carrying vaccines, especially ones they weren't giving on a continuous basis, because maybe it would expire before they would get their money's worth out of it. We have to have a signed consent. You all had to do that for your flu vaccine. So you got to make sure, are you allergic to anything? Do you feel okay today? Have you ever had a reaction to a vaccine? On the form, it has to be listed. What type of vaccine is it? Is it live attenuated? Is it intranasal? Is it subcutaneous? Is it intramuscular? How's the vaccine given? The location of the injection. They have to know, left arm, right arm. The date and time it's given, the lot number and expiration date off the packaging, the NDC number from the packaging, what dose was given, and who the manufacturer was. All of this information is held in case there's a reaction. And then that information is supplied to the CDC. So that's called a VAERS, or a Vaccination Adverse Event Reporting, Drug Reporting System. Or, there we go. Vaccine Adverse Event Reporting System. So anybody who has a reaction to a vaccine, they can go and report it themselves, or they can call the doctor or call the pharmacy, and then a report would be processed, and then it would be followed up on. Was it a unique interaction, or just like anything else that's manufactured, was something wrong with the manufacturing process? Did something go wrong? We do have, we consider vaccines, like I said, over the counter because you don't need a prescription. So the influenza vaccine is one of them. We have Fluzone and Flu Mist. Like I said, pediatrics requires a prescription. Do not use the flu from the generic name to remember the class. Flu in the brand name helps you identify that it is influenza. In my example of flu in a generic name, diflucan is an antifungal. So you got to be careful of that. Oh, that's about it. What did I think? Oh, your drug list has a list of your different types of vaccines that are available. So that is the end of the anti-infective drugs.